Before I started my training, back when I was in medical school, I did a lot of traveling. I actually worked in several different countries. One of the coolest experiences that I can remember was snowshoeing up a glacier in Patagonia. Got to see things that, I never thought that I would get to see in my lifetime. I'm Stephanie Kochav. I'm one of the attending electrophysiologists at Valley Hospital and have a specialized focus in heart rhythm disorders. I've always had an interest in helping people and in biology, and my grandmother was a trained nurse and emergency medical technician, and she rode the ambulance in one of the nearby towns. So when I became 16, I decided to try that with her. I did that for a few years and I really enjoyed it, but where I wanted to be was at the hospital rather than on the ambulance. And so it was then that I decided to pursue a career in medicine. My approach to patient care is really based on the scientific evidence and high quality care. So I really try to, incorporate both of those principles in how I manage all my patients. I know that electrophysiology can be really confusing from whatever arrhythmia they're experiencing to the treatments that we can offer. So I really try to provide simple explanations, make sure everybody has an understanding of, what's going on. And then between myself and the patient and their loved ones come up with a treatment plan that's really individualized to their needs and their health. I love the people that I work with, and I love the patients that I care for. And I also love being able to form, supportive, lasting, continuous relationships with my patients. Historically, women have been underrepresented in clinical trials studying patients with heart rhythm disorders. But I think that there are very clear gender-based differences in the presentation, diagnosis, and treatment for these issues. So I really enjoy taking care of women at each stage of their lives, whether it's as a young woman, in the peripartum period, around labor and delivery, postpartum, or in the menopausal period where arrhythmias seem to become more common. Now, outside of work, I spend most of my time with my family and friends. I have 3 small kids, go to the movies, do various activities. I really love cycling on my Peloton when I get the time, and cooking with my family.